So for the audience out there, we have an opportunity for you to ask questions. And in fact, there are a large number of questions that have come through already. But if you have more to ask, feel free. I'd like all the speakers, if they don't mind, to unmute themselves. And then we can go around and ask some questions. The first question which came in was something that Betty actually alluded to, and it has to do with vaccine acceptance and the whole issue of misinformation around this pandemic. And the question is, how can academies contribute to reducing this misinformation? So maybe, Betty, I'll start with you, get your thoughts on this, and then anybody else on the panel can weigh in.
I think what needs to be done is to get out there and inform the public of what is going on, what needs to be done, and how it should be done. We shouldn't let the people do self-medication, self-diagnosis. It has to come from the respective ministries or from the government. People need to hear it from informed people, not just their neighbors. So I think just more outreach to inform the public is very critical.
So that's an extremely important thing. And of course, it has to be trusted information. And so the political leadership is absolutely critical, as you say. And I think it's fair to say that where there has been a close relationship between the scientists who know, have the latest information, and the politicians, then perhaps the best outcomes occur. I wonder, maybe Akinyinka, would you like to also comment on this? Because you also mentioned something about this, I think, in your presentation. Do you have thoughts on this?
Yes. Well, the Nigerian Academy actually has been involved in a lot of educational activities, partnering with the National Center for Disease Control and the Federal Ministry of Health, and trying to get things out on the mass media and also on social media that will correct misinformation that may be passed around. There's a lot of misinformation going on, particularly on social media. So fortunately, there is a response team of the National Center for Disease Control. And actually, the chair of the National Technical Advisory Committee is a former president of the Nigerian Academy. And he is somebody who is very, very active when it comes to making sure that correct information gets out to the public. So we're actively involved in that.
So that's great. And in fact, it leads to the second question, which was very similar, but specifically along the lines of how did your respective governments engage with the National Academy, or how did the National Academy manage to engage with the government? So maybe, Damen, I could ask you to take that. Do you have any data on that, on how were you guys engaged, or have you been engaged to the extent that you would like?
Okay, thank you. I mean, then the Ethiopian Academy of Science is engaged, I mean, in policy advising in various ways. I mean, one, it has organized special groups for the disease response that work on special areas. For instance, there was a group that did several surveys regarding the effect of COVID on the health workers, regarding the issue of vaccines, the issue. There are a series of studies that were conducted, and I mean the results were provided to the ministry. In addition, within the Ministry of Health, there are working groups in which several of the members are members of the Ethiopian Academy of Sciences. So, I mean, there are these two ways. The Academy itself has organized groups to do surveys and come up with policy briefs resulting from those studies, and within several working groups or committees organized in response. I mean, in the area of the COVID response, there are most of the senior members of these committees are members of the Ethiopian Academy of Science. Thank you.
Oh, thank you. That's good to hear. And as you heard in the introduction, the National Academy of Science was set up by Abraham Lincoln. So, but it's an extraordinary opportunity to have an independent academy that can make science-based investigation in support of public policy. I just wondered, anybody, Phyllis, would you like to comment on on this? And I know South Africa had its own committee, which you mentioned, but was the Academy directly engaged with government beyond individuals who are members of the Academy?
Yeah. So what I must mention is that although those fellows were there, they were also representing the Academy. They were not just there in their individual right as eminent scientists. They were also acknowledged as members of the Academy of Sciences of South Africa. And in the same vein, it is important for me to highlight that when you speak of government, it's also a bit of a fine line for us, because our academy is a public entity, and we receive most of our operational funding from the government. In fact, we do report to the Department of Science and Innovation. So in that way, our feet are, we are sitting on the fence. So one leg is in government and one is independent. So government at any one time always knows what we are up to and tries to tap into the expertise that the academy has.
So that's fascinating because, in the US, for instance, although most of the funding for the Academy comes from government, it doesn't report directly to government. But so I wanted to ask you all, the biggest lesson perhaps we've learned in this pandemic is that when you have a virus that is expanding exponentially, time is of the essence. And so early interventions have huge impact, while later interventions often have very limited impact. And the problem, of course, is that early there is very little information. There's very little evidence that people are dying. For instance, Betty talked about how it's only when people see their family members and others dying. So the question that has come through is, how do you balance this? How do you get early activity when there's so little information early on? What are clues to this? Maybe I'll start with you, Phyllis, and then we can go around.
I don't know what to say. I think I would the best way to answer this was from a personal experience, because when it started, we were hearing it from out there. Personally, when it started in December 2019, and I was watching TV, and they were spraying all these Chinese streets, and it looked something like it was very far until the first case was reported in March in South Africa, and then all these lockdowns came. Then we were on a heightened alert, right? And then only until in January I contracted COVID because I came into close contact with someone. Then that really brought the message home. So I think unless you get it or someone close to you gets it, is only when you actually you're more alert to what you're doing and where you're going.
I think it's been really hard, this pandemic, because as you pointed out, I mean, we watched from afar the total shutdown of Wuhan and wondered if that was in any way, something that could happen. And in fact, many countries, including South Africa, did a very severe shutdown early on. And I think in retrospect, that was probably a mistake, because now what we know is that, you know, if you have mask wearing at a very high level in a community, you can, in fact, get away with quite a lot less of the draconian kind of shutdown. But this is all a matter of getting the community on your side and on board and understanding the importance of these sorts of things. Let's throw it open to everybody. Betty, you talked about the very low levels of mask wearing. In fact, you'd actually even calculated what the level of mask wearing would need to be. How are things going there in Uganda in relation to acceptance with wearing masks?
Well, it's kind of picking up because now we have put faces and names to the victims. Like Phyllis said, initially we were just seeing it on TV, but now we are feeling it in the homes. Last week we buried a neighbor, the three kids are in ICU. Then the two other neighbors, close friends, were also dead. They died the day after. So now people are really believing. Everywhere now they say COVID is real. COVID is real. Initially they were just saying COVID, that is politics. Government wants to eat money. So I think they're accepting that it is with us, and we have to, it's up to me to protect myself and my family and the neighbors. So there is acceptance currently going on in the country. They're accepting that it is with us.
Yeah, it's very interesting to me in the very limited data that's been shared in our session that Uganda clearly is in the midst of a very severe wave. And I don't know if you have the genetic information. I would suspect it's almost certainly what we now call the beta coronavirus variant, which will be the 351 variant. But it was interesting that Ethiopia, you said, was on the way down, and it doesn't seem like there's been a third wave yet in Nigeria. So given that perhaps a third wave is inevitable in Nigeria, I just wonder, Akinyinka, what you think about how it's possible to get the population to start wearing masks, for instance, to prevent this wave from coming.
Well, thank you. Well, let me first allude to the point you raised earlier about trying to get ahead of the curve.
Right.
And to say that it's probably much more important to get the facts right than to put out information very quickly that may turn out to be incorrect, because subsequently the public may then have less trust in what the scientists say. So I think it's more important to get, any advice that's going to be given should be based on actual information that's available, and it should be limited to that and not try to extrapolate or guess as to where things are going. I think that's very important. And coming to the issue of people wearing masks, the level of compliance is actually quite high in the urban centers in Nigeria. It's only out in the rural areas that people don't seem to adhere too much to those instructions, and which is fortunate, because the population density in those places is much less. So the propensity for transmission would also be expected to be lower. So, but the key is to continue to educate people on the importance of doing these non-pharmaceutical intervention activities to protect members of the public. Unfortunately, we are able to vaccinate about 2% of our population. So vaccination is still not an option for us now. But those non-pharmaceutical interventions, we continue to work on them and educate the public about them. Thank you.
Okay, thanks. So we did get a question also about the extent to which the national academies can facilitate research on new strategies. A few of you mentioned this. Of course, given the timeline of the pandemic, the likelihood that you can find a truly new drug, make it from scratch and implement it is very low. So many places have looked at repurposing existing drugs, and there's been a lot of misinformation out about that. I just wondered if anybody wants to comment on this. Somebody mentioned that you had a task team to look at ivermectin, and I just wondered how that went.
Yes, it was. It was actually a webinar on that we hosted on understanding ivermectin for COVID-19, because it has been quite a controversial drug, and it's only, if I am correct, in South Africa, it's only in fact very, very particular cases, and only a few institutions that are allowed to have access to it. Because I think this came about, I would think, out of desperation, because around January and December, that was when South Africa was in its second phase, and which was actually the very severe one, and it was in fact the phase during which I also I also got infected. So at that point in time, people were just scrambling for alternatives, because here in South Africa, the sentiment was that if you end up in a public hospital, you will not come out alive there. So most people stayed away from going to the hospital, and yet the government advice was that don't wait until you feel too sick to seek medical help, come early. But people were doing the exact opposite. And I would also like to mention that at the very, very beginning of the pandemic, many countries were struggling in accessing the PPE. And so as much as the lockdown was implemented, and so we all stayed at home, we were contained. But when we could no longer be in lockdown is when it was opened up, and only much later that many of the health institutions around the country were able to get PPE from the big manufacturers in China and other manufacturing countries.
Oh, that's great. Thanks. So we're almost done in time, but there was perhaps a controversial question, but I'll ask Damen if he can respond to it. The question was, does the Academy in Ethiopia have any data about the impact of the conflict which is currently going on in Tigray on the COVID response in Ethiopia? Is there anything you can say about that?
Not I know of, at least. I don't think so currently, but there were roundtables and panel discussions on this issue, in which most of the, led by actually the fellows in the academy, even though it's organized by the university. So there are those proceedings otherwise.
Okay, well, at this point, I want to thank you all. I think it really has been very, very fascinating to see the role that national academies can play. And this is obviously new. Most of the national academies in Africa are relatively new. And it really highlights an extremely important way in which national academies can interact with government. And I certainly, in having an opportunity to review the PERC recommendations and the data which has been collected on the ground in Africa about how communities are perceiving this pandemic, I think is very, very fascinating. So to finish, we have closing remarks, and I'm delighted that our closing remarks are being given by Tom Frieden. Tom Frieden, as many of you will know, was the head of the CDC for many, many years, and more recently is the president and CEO of an organization called Resolve to Save Lives, which is focused in large part on the question of pandemics. So I think I'll hand over now to Tom for his closing remarks.